Marfan Syndrome, or MFS for short, is an autosomal dominant disease, meaning an abnormal chromosome can be inherited. In this condition, the genetic mutation for fibrillin 1, FBN1, is either dysfunctional or less abundant. Fibrillin is a glycoprotein located in microfibrils in certain connective tissues. It's responsible for regulating transforming growth factor beta, or TGFB for short, which is secreted by many cells including macrophages to stimulate tissue growth. Reducing the amount of functional fibrillin compromises the tissue strength and elasticity. In conjunction with upregulation of TGFB, results in an individual with Marfanoid features. Marfan syndrome can be seen to affect bones, lungs, heart, eyes, and cardiovascular structures. Individuals with this condition tend to be tall, thin, with long limbs, and with long fingers and toes. Other features include scoliosis, a downward slant in the eyes, and a narrow palate. Overgrowth of the ribs results in pectus excavatum or pectus carinatum, where the chest caves in or points out. Individuals have stretchy skin, flexible joints, and have the ability to flex their elbows to 180 degrees. Underneath the surface, in the lungs, bulla, blister containing serous fluid, is formed, which compromises the infrastructure and integrity of this organ, where there is a risk of spontaneous pneumothorax. The retina could detach from the eye, resulting in the loss of peripheral vision, or the lens dislocate, causing blurred vision. In the cardiovascular system, a person with Marfan syndrome is present with aortic dilation or aneurysm. This increases the risk of aortic regurgitation, where the aortic valves don't close properly or the blood leaks back into the heart. When an aortic dissection, rupture, occurs, mortality rate is 50% when left undiagnosed. The ascending aorta is the most commonly affected, most life-threatening, and requires immediate medical attention. All of these issues presented in Marfan syndrome can be treated. In the case of the dislocated lens, it can be replaced with an artificial lens, an aortic enlargement, either with surgical repair, beta blockers, or angiotensin receptor blockers, which decrease TGFB signaling. 75% of individuals inherit the condition, and 25% attain it as a result of new mutation, essentially affecting everyone. Marfanoid features aren't always present and can be hard to identify depending on the severity of the disorder. It's not usually noticeable at birth and shows up with age. Clinical features include aortic disease, a dislocated lens, family history, and an FB1 mutation. Someone who is left undiagnosed with Marfan syndrome may only live up to 30 to 40 years, whereas somebody who is diagnosed can easily be treated to live a long and full lifespan. Marfan syndrome affects roughly 1 in 5,000 people, according to the Marfan Foundation. When the firstborn child has Marfan syndrome, siblings will have a greater risk of attaining the condition. Although this condition is common, it has a similar occurrence rate compared to the more well-known diseases such as cystic fibrosis and muscular dystrophy, and is often dismissed. In this day and age, with the help of modern medicine, knowing the disorder and its symptoms could be the difference between a short life and saving one.